Okay, good morning everyone. First of all, want to thank Denise and your company for inviting us to do this presentation. It's really helpful for people to understand how they can look after themselves and really for long-term improvement or recovery. Before I get started, would love to understand a little bit more about you as you're working here, any issues that you might be facing, anything that you would like to get out of from this session. Any brave people who want to put their hand up and share why are you here? What would you like to achieve from this session?
Probably understanding how you should be sitting at your actual office desk, because I mean that is largely a bit more controlled than what it would be at home. So it's probably being able to, some of us do work from home. So
Yeah.
my setup at home isn't, designed. I mean, obviously there's a default design that goes into those office setups from whoever installs them.
Yes.
And you've got a chair that can go up, down, and you've got your adjustment levels, but that isn't always how
Yeah.
things operate at home. So it's just trying to understand the basics of.
Okay, that's a very fair point. If I summarize it, does it means what you're really saying that with the home setup there is a little bit more flexibility? You can customize it, whereas with the setup in the
Less. No,
less.
The office has got more flexibility than
Office.
home.
Oh, okay,
Yeah,
that's very
because
good.
your office, you can adjust your chair and your screen heights and everything, but maybe at home it's a bit more fixed. So what should you be looking to optimise and try
Very
and work on?
fair point. Very well done. Good. Didn't catch your name.
Rowan.
Rowan. Excellent question, Rowan. And
How do I type without scrunching up my shoulders like that?
neck traction. We will share something later in the session with the QR code. You know what? There's one exercise which you would love eventually, if you know what you mean.
There's one thing I'm not sure of now is we've got, rather than one screen
Yes.
that you plonk yourself in front of
Yes.
and look at,
Yes.
we've probably got one there, one there, one there.
Yes.
So there's this, if I'm looking at that one, should I be, physically
Turning your body.
Yeah, so just accommodating like a 3-screen setup,
Yeah.
which most of us have. So I think there's a lot of probably twisting going on.
Yes.
You got
Yeah.
4 screens.
Have I? Well, this one as well. Probably.
Well, a very fair point. I didn't catch your name.
Scott.
Scott.
Yeah,
Scott.
you didn't catch it because I didn't give it.
Yes. So the gentleman at the back with the
Andrew.
Andrew. Like Andrew, Scott, and Rowan, all very fair questions, and I'm pretty sure if we keep this going, there'll be a lot more questions, but very relevant. Hopefully, towards the end of the session, you would have answers to some of it or all of it. If you feel I haven't covered, or if you still have any more questions, we have allocated time for it. So unless until there are some really burning questions during the presentation, put your hands up. Otherwise, just to let you know, we have allowed time to answer these questions later in the session because we really want you to get something specific out of this. One of the main purpose and the core purpose of this session was how we can enable you to set up and modify your station whether here or at home as much as possible independently. So if you leave today's session towards the end of 50 minutes or so, thinking I know 2 or 3 things that I can do on my own, awesome, that's what we really want. Okay, so we'll get started. My name is Mukul Singla. I'm from Therapy of Sports and Spine, and I'm joined by Dave here at the back. Do you want to say anything?
Yep, so my name is Devendra, the full name there. I prefer Dave, and I work as a physio at Therapy of Sports and Spine as well.
Good.
Okay.
Welcome.
Now we all have already discussed that how sitting for long hours or working on the desk, whether it is sit to stand desk or the sitting desk, can cause some issues. Why? Prolonged posture, prolonged sitting. We all know that. Before I go further, why don't we do a quick experiment? Can I get all of you to lift one index finger? Okay. Place the other index finger on top of that, whichever finger it is, and now pull this backwards. Hold it for 5 seconds. Is it really hurting? Not much. Maybe. If you hold it for 5 minutes.
Everything hurts, mate.
If you hold it for 5 minutes, will it maybe get slightly uncomfortable?
Yeah, cause
What about 5 hours?
nah.
Yep. Okay, it's very simple. It's logical. There's no rocket science here. But at a physiological, what's actually happening there is something called as tissue creep. We won't go into too much of physiology. In very simple words, by holding a certain tissue, muscle, joints, ligaments, no matter what it is, for an extended period of time, it starts changing. It starts evolving, and sometimes for good, sometimes not for good reasons. It's important to understand this basic constant hold is quite often what is responsible for a lot of aches and pains, discomfort, fatigue, and start of some long-term issues. So
that could be something as simple as I sit with my legs crossed, like I'm guessing, like you know how you just cross your ankles over.
Yeah.
That's not necessarily your natural position to be in. I've found that when I've done that, I actually end up with hip issues if
Yes.
I'm doing too much of that. So that's the sort of thing you're talking about? No.
Not really. But it's a fair point, and we can talk a little bit more about it down the line.
Fair enough.
But while we are talking on this, my physio brain is going in a different tangent. Cross leg sitting is one of the most common, I can say, reason when we drill it down for SIJ or hip issues. So in a way, you are touching to something that we see quite often clinically. Coming back to constant holding, constant sitting, constant any position really becomes the foundation for short-term issues and long-term issues. If we get that clear, the answer is obviously, from the very beginning, it is quite simple. To basically to improve your body or any sort of recovery, it is important to be relatively comfortable and stay mobile, stay active, keep changing positions, right? Again, not rocket science. Common culprits: poor posture. We all know that, we all have been there. Now this is one of the pictures that we could find. Obviously there are a lot of other pictures on the internet, lot more graphic, but in very simple words, regardless of where you are, you may be in your car, you may be at home, you may be at the couch, you may be sitting here right now, and I would love to point out a few people, but I'm not. Or you may be at
Everyone suddenly set up a lot straighter.
or you may be at your work desk. So I do want to emphasize here, poor posture and poor ergonomics are two different things. They often go together, but they are not always interrelated. Essentially what I'm saying is, you can have a really, really good workstation and you can still sit in a poor posture. Or you might have a terrible workstation and you may sit reasonably well. So they both influence, but they are not directly related to each other. Stress. Life is life. We all go through different ups and downs. Who here hasn't noticed that when they were having a little bit of a more personal stress, their work was affected, their posture was affected? We all know that as soon as we get tense, tight, or pressure, our shoulders ride up. It is not just you, it is everyone. Physiologically, based on research, we know that stress is quite often stored in our body. So as we get tense, muscles do get tense, and this is the most common area where you see, as physios, we see this all the time. People who are under some sort of stress, either mental, physical, personal, or work, quite often have aggravation in other conditions which they feel is not related. Sometimes they have a flare-up of an ankle. It has nothing to do with the posture, but has something to do with the stress. And minimal movement. We already touched on it. Lack of mobility is one of the root causes of a lot of short-term and long-term problems. Now let's look at this posture. Some of us may relate to it, some of us may not. Some of us are already sitting in a better position since we started this conversation, which is amazing. Let's, for the experiment's sake, can I please all of you, including people who are standing, can I please all of you to find a chair or a stool, just for a short experiment, please. Now, when we are conducting this experiment, this is the only time we ask people to slouch. So I want you to actually slouch. Get into the worst posture you can think of. Really, 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 really bad posture. So this is the only time you actually get a license to sit as slouch as possible. Awesome. Now I want you to, whatever comes to you, doesn't really matter how right and wrong, try and correct your posture. And that's what we see all the time. That's exactly what most people will do. So what did we all do? From here, we straighten our spine. Now I want you to really correct the posture, sit as upright as possible, Now, the amount of effort you're putting in right now, how long can you hold it for?
10 seconds.
10 seconds? I was hoping 5 minutes, but that's okay.
She's an underachiever.
No, she knows her own limitations.
Now, you're not alone. The idea here that we're trying to convey is sit in a good posture or correct your posture is very easy to say. It's not really that easy to do if you don't know what you're doing. If you know what you're doing, it's actually very, very simple. Now, can I ask you to slouch again, please? And as you slouch, bring your attention to the...
It feels so much better, doesn't it?
I know. So, no one is scared of spines or human body. By the way, this is not an actual person, this is a model. Now, obviously this is neck, this is middle back, this is lower back. I want you to bring your attention to your tailbone. Your lower back, if you place your hand on your tailbone, bring your attention here. As you slouch, what happens? Do you feel your tailbone goes backwards? I want you to bring your tailbone forwards. Don't worry about your neck and shoulders, just bring your tailbone forwards. Keep pushing your tailbone forwards. Push it till it hurts, mildly. And now just take the pressure off a little bit. Make a note where you are right now. How long can you hold this position for?
Maybe 10 seconds.
11 seconds.
Oh,
The difference is, in one previous technique, most people try to correct their upper body without really correcting the foundation. In the second attempt, you corrected the foundation. If you take one message home, this would be that one message. That to correct your posture, correct the foundation. If you sit your tailbone upright, and did you also notice when I said correct your tailbone, head, neck and shoulders automatically fell in the right alignment. You are not really forcing them, right? And that's why once you get used to it, it's actually much easier to hold it. The key message here is that to keep your posture upright, back upright, shoulders upright, all of this is doable if you know exactly what you're doing. The idea is that your spine, your body should be strong enough to sustain it. And where it is not, it's perfectly okay to take some support, which is environment. That takes us to the next point. Now yes, we are going to talk about ergonomics, how to sit upright, how to maintain a good posture. But just one thing I want you to all to remember and keep in mind, that is only 50% of the solution. You can change your environment, you can get the best desk, you can get a $5,000 desk, $10,000 chair.
You can't get a $5,000.
No,
That's wrong.
that is
At work from home setup.
here. Or you can get a $50 chair. No, jokes apart, you can spend as much time, energy, money, or effort in getting the best setup, but keep in mind that is still going to be only 50% of the solution, because the remaining 50% is within you, within your body. Yes, today we are really going to focus on the first 50%, but I really want you to remember the second 50% is actually more important, of what you can do with your body. I hope I'll probably repeat this message again and again, because you can probably see where it's coming from. I'm really passionate about people looking after themselves and their body, so no matter where they sit, they are fine. Or no matter what they do, what they work, they are fine. We'll talk about the ergonomic workstation setup now. This is where I'll invite Dave to come in, maybe share some insights. So just to give you an idea, this gives you a kind of sneak peek into the things we look for when we are doing an individual assessment. So on Denise's request, we have tried to create a presentation that actually teaches you or gives you some insight of what you can do yourself at your workstation.
Cool. So to start with, I'll just go back to that particular slide, and I'll just ask you guys, what do you think in order to correct the chair? Let's start with the backrest. What would you change in order to get yourselves in a good supported posture?
Lumbar support.
Yeah, that's one thing. Yeah. What else?
Not have it leaning back too far, a bit more upright.
How about 90 degrees? Is that something that we're looking at?
I would think so.
But again, gravity is not supporting you in that, isn't it? So a little bit of a lean backwards, so gravity actually assists you there. That's actually good. What else? How about coming to maybe the seat there?
High.
High, yeah,
So your feet can be flat on the ground.
that is right. But if
Slightly tilted down a bit.
that is right, that's actually good.
Takes
Why?
the pressure off the hips.
That's very good. So again, that anterior pelvic tilt, as Mukul mentioned earlier.
Helps you push the
That's right.
foundation forward.
Very good. So that's very good point made. So that's amazing.
Mate, I've redeemed myself from earlier.
But now, how about if you've got your desk or the monitor a little bit too high, you can't get it as far down. So in that way, you have to get the chair height a little bit higher up, but your feet are hanging in the air. What would you do then?
Short people problem.
Definitely, I can relate to it for sure.
You'd buy one of those wedges, Denise, like on the next page.
Oh, you managed to get a there you
Hands up
go,
those
catch
people
that.
who already have a footrest. There's a few of you.
Mm. Oh, there you go.
Or you can grow.
Yeah.
That's really good. So that's one of the good things.
If we stretch you out enough, you might actually reach.
I've been trying for years, Scott.
Now, how about there's actually one other thing, which is your shoulders. You have got some weight on your upper body or the upper limbs. What would you do to support them? Because if they are just hanging, they're going to pull on this muscle right there. That muscle is going to work really hard to keep that way, and it's going to get tight.
Desk height.
Desk height, yeah, you can support your elbows on there. But what else? There you go, armrests. So that's actually a good thing.
On a chair. Armrest on the chair.
Yes,
Right.
on a chair. But if you
Not
don't,
on the desk.
if you don't have an armrest, that works well as well. You can support your elbows on the chair, but making sure you're not leaning as far forwards, so that you're not basically chicken necking into your monitor. Does that make sense?
Oh, like someone at the back there.
Yeah. Not pointing any fingers.
No.
All right.
He gave
Okay.
himself away.
So now let's look at this slide there. So you guys covered a lot of things there. So again, seat height, as we discussed. The feet need to be flat on the ground, and if not, then we need to have a footrest to support them. Again, the one other thing there is, if you have, or imagine yourselves maybe in an airplane, when you have no leg room as such, and you're sitting in maybe like a 5-hour flight. How does that feel? Uncomfortable, isn't it? So again, you should have enough leg room to keep your legs moving, and just kind of getting that blood flow in, so it doesn't get as tingly or numb. The hip-knee angle, again, that's one other thing to note. It should be at 90 degrees, roughly speaking, 90 degrees between the thighs and the lower leg, and between your trunk and the thighs, it should be roughly 90. But as we discussed earlier, the seat should be tilted a little bit back, so make it 100 maybe, so that gravity is assisting that back. Your thighs need to be completely supported in the chair. Can anyone tell me why?
Otherwise, they feel like they're hanging off the edge and you get pain and constriction.
That is right. And the other thing is, if they're hanging off a little bit, the edge of the chair, it tends to dig into the end of the thigh as well. And
So
can make
sitting
it
on the edge of the chair wouldn't be a good idea.
Yes, I know that.
It wouldn't be. All right, now we know who does it. Okay. Now, okay. Again, the seat tilt, as you mentioned rightly, it needs to be tilted a little bit forwards, correcting that foundation. And the backrest, it needs to be roughly 100 degrees tilted back. And coming now to the armrests, as we discussed again, you need to have an armrest just to support the elbows on there. It takes the pressure off the shoulders. Shoulders are nice and relaxed. And if there's no armrest, you rest your elbows on the desk there without leaning as far forwards. And okay, coming to desk setup, I'll hand it back to Mukul to take it from there.
Guys, I think it's almost been 15 minutes since we started, 15 or 20 minutes, so you know why I'm doing this. Can I please get all of you to stand up again? Now, for guys who are standing in front of a desk like this, if you can just imagine you come in front of that desk. Oh, just come in front of that. Imagine this is your workstation. Whether you're sitting or standing doesn't really matter. Stick your elbows by your side and clap. I just did that for fun. Now the idea is, you start from here, keeping your elbows by your side, open up your arms out like that, keeping your elbows by your side. Elbows by your side. Elbows by your side.
Twist your
Yep.
ribcage open.
And bring your hands in. When you take your hands out like this, it almost creates roughly 90 degrees angle between your forearms. Roughly. Doesn't have to be right or wrong. Now, this space that you just discovered is your inner zone. Everyone okay with that? And you can please take a seat. So, we achieved two purposes just now. First, getting you a bit of an insight of what exactly your inner zone is, what your 90 degrees is from the center. So 45 roughly on one side, 45 on the other side, and the inner zone. that inner zone is where most of your frequently used items go.
Your mouse, your keypad.
Exactly. Your keypads, maybe
Your
your phone, maybe a notepad, anything that you use most often. This is based on frequency of use, not importance of use. Essentially what I'm saying is, if there's an extremely expensive item, but it's not frequently used, it doesn't go there. This is based on frequency of use. If there's one tip you remember about your desk setup, that's all. That 90-degree inner zone. Everything outside it is outer zone. So whatever you use less frequently, it may be one monitor that you don't use as much. It may be a notepad, it may be your mobile, it may be a phone or a phone connected to the desk. Whatever is less frequently used is outside this 90-degree zone. Now, we can relate with both of these desk pictures. Once again, you don't need to point out, but
Yeah, the bottom one's mine.
so this, if you are familiar with the concept of bell curve.
Yep.
Yep. So over the years, we have seen that no matter where we go, any office would have a typical bell curve. There are about 20% people whose desk looks like the top picture.
No.
There are 20% people whose desk looks like the bottom picture. And there are about 50-60% people who fit somewhere in between. If you feel that there are more people in your office where their desk looks like the top picture, trust me, you're extremely lucky. Just implementing this principle of most frequently used items in your inner zone, decluttering, itself solves 50% of the problems. It's that powerful, it's that strong. And obviously getting into a habit or routine. So if there's something you want to remember, that's all you need to remember. If you're using a lot of phone, then consider using a headset and try to use your phone from the non-dominant side. This is again a very common mistake or correction that we see, that people tend to keep their phone on the dominant hand. So when they are answering the call, they actually have to crunch their shoulder while they're typing or doing something. As a result, a lot of neck, shoulder issues, and all of this can be avoided, or it is this correction is needed for any long-term recovery or rehab. Desk setup or monitor screen. Again, some of this information is very straightforward, nothing fancy. Monitor, if you again sit on your desk or stand on your desk and you stretch your arm out, your fingertips should be just touching the monitor. Just touching the monitor. You should not be reaching forward. You should not be scrunching your arm before your monitor is too close. If it is too close, it's going to strain your eyes. If it is too far away, it's going to strain your eyes. And when our eyes are strained, what do we all do? And what that predisposes you to? Neck, shoulder, upper back issues, and obviously core issues. So in simple words, monitor, arm length away, just barely touching when you're sitting in a good alignment, in a good posture. That's the baseline. Also, it's important to notice height of the monitor. If you Google it, which I'm not encouraging you to Google it, there are some different recommendations of how the monitor should be set up. What we have found that a lot of this information is outdated from many years ago research. Back then, the computers or the desk or the monitors were not as modifiable. In simple words, what I want you to remember is your top level of your screen should be just at your forehead level. So when you're on your screen, your head should be neutral and slightly down, not up, not looking too far down.
Question, yeah.
Yes.
So if you've got
Two.
two monitors
Yes.
at that level, that's fine. You've got they're at the same level. And sure, you might have to twist to see
Yeah.
one, or you
Yes.
park yourself in the middle of them. Are we better off to close the third screen to stop you from looking down at it, or that
Like the picture
like
at the
this
top.
one here,
Mhm.
or is that level of, if it's the least used screen out of the three, but it's still good to have there,
Yes.
is an infrequent looking down at that screen okay? Or are we better off to close and just use the two screens?
Or
The-
to raise the third one, put over that side.
There is no right and wrong. Honestly, I wish I could say yes or no to any of
Or
those.
do we put 10 screens all at the same level?
There's no right and wrong to that as well. In simple, in simple words, without getting too technical, you just need to ask yourself. If there are three screens, just do a quick calculation, and roughly, it doesn't have to be rocket science, roughly how much time are you spending in a week, not in a day, in a week, on which screen?
Scott, also it matters if you want your computer to be quick. You've got 3 screens, it actually slows your computer
Yeah.
down by quite a
If you're
decent
finding
speed.
though that you're working predominantly on that screen, you
Move
move
it
it
up.
to
Yeah.
one of your 2 main
Okay.
screens.
Yes.
Oh, yeah, no, I do that.
That's that's exactly the point. That
Suggestion, can you maybe give us a demo using Scott?
No.
Yes.
What?
Yeah.
if we have time, if we have time,
If we've got time?
if you have time, we would love to do that.
There we
Yeah.
go,
But
yes.
Yes.
Solve the problem. It's going to
Scott,
set you up, buddy.
thanks for volunteering. Okay, coming back to this, to answer your previous question, identify the most commonly used screen. The first thing I'll do is bring it in the center. Other than like I honestly am not a big fan of the setup that I saw there, where there were 2 screens on either sides, and in the center you're looking at a joint.
Yeah.
I would bring the main
main
screen
screen.
in the center, the secondary screen on the other side, and if there's a third screen on the third side,
Oh, the third side.
like on the other side. That's what I would do. Anyway, moving on. Now this
Ah,
Can I
Right.
just say that curved screens are really good for
thanks,
that.
Rodney.
yes,
You just move your head.
yeah, that's also a good idea. Again, it depends on how large it is, because nowadays,
Get
yeah,
quite wide,
That's right,
yeah.
I'll thank you later too.
I know where this is going. Well, this office is really well lit, from what I can see. So we also want to be aware of the light and avoid glares from the windows and things like that. And nowadays, you can get screens where you can actually do the setup. If not, you can also put a screen protector or something like that. In simple words, I want you to be in that position, looking at the screen for 1 hour or 2 hours. Your eyes should not get strained. There's a very simple tip. Again, this is where it comes down to, if there's one tip that you remember that you take from today's session in terms of your screen and your monitor, that would be how you interact with it. And it's a 20-20-20 rule. So every 20 minutes, look at an object or something which is 20 feet away for 20 seconds. I would also encourage, again, if it is possible or practical, maybe use some of your windows or open the window blinds or keep a few window blinds open. So you're looking not just 20 feet away, you're looking at the outside the window. The idea here is that you want to shift the focus, your vision, away. And again, it goes into a lot of physiology of when you shift your focus away, your neural response and your eyes respond differently. But the whole idea is you shift your focus away for a reasonable duration. And research has shown 20 seconds is enough. So if every 20 minutes, if you shift your focus away for just 20 seconds to an object a little bit further out, you'll be fine.
For those that aren't so much into inches and feet, what's the metric conversion of that?
Can I get you to look at that
About
window?
7 meters.
Yeah.
is-
7
Yeah.
meters.
Yeah.
It's 3
Yeah.
curses.
Yeah.
Yeah.
So,
I get the 20-20-20, but it's just, yeah, some of us
So-
don't really work
Can
with
you put
feet.
them lie on the floor so we can measure?
So really towards the end of this hall.
Okay.
Yep.
It's Andrew.
Okay, cool.
Keyboard. Again, we kind of already covered that, but but by the way, where should the keyboard go? Inner zone, outer zone?
oh,
Inner
yeah.
zone.
Inner zone. For people who are working on the keyboard. For people who are not, it doesn't have to be there. The other thing to keep in mind that your wrist should be relatively neutral. Now, neutral is a very physio concept, but if I can get all of you to hold your hand like this and lift your hand backwards, all the way up, all the way up, all the way up, all the way up, and all the way down, all the way down, all the way down, all the way down, all the way up, all the way down, all the way up, all the way down, and stop at a midpoint. Really, that's neutral. Hold your hand like this, all the way one way, all the way the other way, as if you're saying bye-bye. Not the elbow, just the wrist. And midpoint. Now here you will notice that your midpoint is not straight, it is slightly tipped towards the little finger. If you purely look at the neutral, there's a physiological reason. We won't go into too much of that, but that's the whole idea.
Yes, Denise.
The whole idea is to keep your wrist slightly neutral with your hand slightly out. Now when you think about it, there are keyboards that actually allow that to happen. We call them curved keyboards or split keyboards. They are really fantastic if you're spending a lot of hours on the keyboards. So hands relatively neutral. If based on your setup, if you need to use a pad to support your wrist, it's perfectly okay.
distance from keyboard from you?
Very, very good question. You tell me.
I would have.
listening?
What did he say already?
Yeah.
90.
Where does it go?
Right. I would have thought like that.
In your zone.
So you sort of.
Yes.
Yeah, elbows in. Yeah.
Yes.
Okay.
Yes.
Right.
Yep.
Sorry.
Now, just to also to clarify, it doesn't mean when you're working on your desk you have to be like this. Just to clarify. This is just to.
That's the way some of these guys are at the pub when you ask them to buy a beer.
This is just to identify your inner zone.
Dinosaur arms.
Mouse. Again, it comes down to people how much you use it. Wrist should be relatively neutral. Mouse again should go in your neutral zone. A very simple tip for people who are using a lot of mouse is to actually play with the sensitivity of the mouse. We know that when you're using a lot of the mouse, a lot of clicks, that can result into some RSI type issues. So, and especially if you're scrolling a lot in and in for the index and the middle finger. If you increase the sensitivity, something as simple as that, you will notice you don't need to scroll as much. It takes few days to get used to it, but that can actually reduce a significant amount of friction, wear and tear in your hands and fingers.
Did you say decrease or
Increase.
Increase, yes. So you don't need to scroll as much. You just
become
just
more
click.
sensitive, okay?
The other option is to consider using a vertical mouse. Again, they are fantastic, especially for people who are dealing a lot with numbers.
What's that?
Oh,
Sorry, what is a vertical?
vertical mouse is basically it's not like this. It's almost like that.
Oh, right. Okay. I've never seen that.
Now the next slide is not working as I thought because again Mac versus Windows. So you're going to get a sneak peek. Otherwise, this was going to be a test.
Yep.
So if I can take a promise from everyone, look at the pictures. Don't read the script.
Okay.
Promise.
Yeah, where's the
Promise.
pictures?
We'll try.
So what are the issues with the top first picture?
Angle.
Yep.
Oh, the monitor's
He's on
way
the
too
edge
low.
of the
Yep.
seat.
There's no adjustment for the chair.
So he's basically seat's going up instead of down.
Yep.
His
There's
back
So
rest is
sitting
more
in
than
the
fair bit of
100.
gap here.
Back rest is more than 100 degrees. back.
Thighs are hanging off. Yeah.
He's not supported his legs.
Yes.
He's sitting on the front edge of the chair.
Yes.
He's taking his glasses off so he can't see it anyway.
Well, his laptop's just too far back on the table, so if he was actually sat in, the laptop would need to be close to the edge of the table.
He's on there.
Yes.
Scott,
Were you listening? Yes.
would you consider working as a consultant for a physio firm?
I will maybe in about 3.5 years.
Second picture.
Chairs, feet need to be flat, or have a footrest so that.
Have shoes on.
Yep. Yep. Third picture. Very obvious.
Well, the hand positioning of the mouse, it's not in his 90 degrees, so he's reaching into having a weird position, so he
Well,
needs to move it closer.
The desk is too high for him because
Yeah.
he's having to put his arms up like
Yeah, well,
that.
maybe his chair isn't high enough.
Or his chair's not high enough either way. Yeah.
Awesome. Give yourself.
Oh,
You go, boy.
Okay.
try to get the next job.
Moving to the next point. Now, this is a very, very common question nowadays. A lot of people ask, tell us a little bit more about sit-to-stand desk, or shall I get a stand-up desk or a workstation that goes up and down? You know, they're two different things. Like I saw that there are some workstations that go up and down, and there's some stand-up desk as well. How do we use them? What are the guidelines? In very simple words, whatever we have covered so far,
Applies.
all of it applies to a sit-to-stand desk. There are few things to keep in mind and consider. Now, I've been saying this for a few years and I've already started seeing many of these issues. I feel that we are just before an epidemic, before people start complaining of varicose veins, knee, ankle, hip arthritis. Why? Because a lot of people have gone from sitting long hours to standing long hours. It will give rise to, it's already giving rise to different set of issues. I'm not discouraging from using a stand-up desk. All I'm saying is alternate, use it wisely, use it the way it works for you, and also know a little bit more about the physiology of how the body works. In very simple words, change it if possible every half an hour is recommended based on research. Practically, if it is not possible or if that's too often, too frequent for you, at least every 1 hour. Most common correction that we see, and I see in the clinic all the time, is people say, oh, I sit in the morning and stand in the afternoon. Again, 3-4 hours sitting, 3-4 hours standing. Too long. Or I use a fit ball, like what you see in the picture, which is fine. But in the end, it is not going to replace that frequent change. So one of the recommendation to make it easier is wherever possible get an automatic or electric workstation or a desk where you don't have to pull the lever and lift it, because there is some resistance. If it is easy for you, you're likely to use it. And second, use some reminders either in your phone or your computer. So, and there are some apps and there are some softwares nowadays, or you can simply use your computer inbuilt clock that it flashes every 1 hour or so, or every half an hour, whatever works for you. But make sure that is one change you implement with, if you're using workstation or sit to stand desk, that you're changing every half an hour, 1 hour. Again, if you're standing for that long, consider using an anti-fatigue mat, avoid leaning, slouching forwards, and get into a routine of doing 1 or 2 very simple stretches. Again, we are coming to around 15-20 minutes mark, so that prompts me, can I get all of you to stand up please? And we'll do a little bit more than last time. So I want you to stand with your feet together, heels together, and stretch your arms up and try to touch the ceiling. Touch the ceiling, touch the ceiling, touch the ceiling, touch the ceiling, go on your toes, touch, 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 touch,
Just hand
touch,
touch it.
Feel the stretch. Now where did you feel the stretch?
In my lower back.
Lower back, very good.
Down
Where?
Calves,
Calves.
shoulders.
Shoulders,
Knees.
knees, armpits, rib cage. That's it. You can please take a seat. There's no right and wrong, honestly. You feel the stretch wherever the body is moving from or wherever it needs stretching. If someone would have said they felt the stretch around their lower tummy, lower abdomen, just below your belly button, I'll give them 2 extra brownies. Because if you had said that you feel the stretch around your belly button or just below your belly button, around your core, then your body in a reasonably good shape. So ideally you should feel the stretch around your groin or in your arches or the inside of your legs. Anyway, that's again a very, there's a physio talking, we don't need to worry too much about it. In a summary, workstation improvement, no matter what you do, no matter what changes you do, now or later, they represent only 50% of the solutions. The other 50% is within your body, and the other 50% is more important. Why? Because your workstation can change. Your desk might change. Your department might change. But if you know what you're doing, if you are in a good shape, you will carry that improvement with you. And that's why you understanding about what changes you should be making is extremely important. How do you improve yourself? Physical conditioning, fitness, strengthening, stretching, all of it. Now this is going a little bit off the topic, but over the 24-25 years of me working as a physio, it really comes down to this. One line, you maintain the flexibility of your spine and 2 large joints. Large joints are your shoulder joints and your hip joints. Even if you do some 1 or 2 minutes of simple stretches, just to maintain your spinal flexibility, your hip and shoulder flexibility, chances are you can avoid, ignore, and possibly get away from 70 to 80% of the problems that are part of RSI or are part of any other aging related process as we get mature. And we all get mature, and that's normal. Now, I know what I'm saying, and I feel comfortable saying this after seeing thousands and thousands and thousands of people who work either in the office or they do collar work. Doesn't really matter. This is one key, one tip. No matter what you do, but as long as you're maintaining your spinal flexibility, hip and shoulder flexibility. So, important to remember, sitting for long periods is detrimental to health. Regular movement, keeping circulation, reducing fatigue, prevent stiffness. Tips that you can pretty much implement straight away wherever possible. Engage in walking meetings. We have started doing a lot of this, and it's almost like a trend that's happening. Using a stand-up desk, use it wisely though. Change your position every few minutes. If possible, every 2 to 3 hours, do 2 to 3 minutes of stretch. And a simple regime, a simple routine that only takes 2 or 3 minutes goes a long way in maintaining your body, your health and your fitness. And remember, for your eyes in particular, whether sit to stand desk or wherever, 20-20-20 rule. Look for an object, shift your gaze 20 feet away or roughly 7 meters away for 20 seconds every 20 minutes.
Could you show us the standing child's pose?
The standing?
Standing child's pose.
You know what? Why don't you take out your phones now? Scan the QR code, and by the way, we have some. Should have left it out earlier here. So what we are sharing there, you can pass this around.
Okay.
You can scan that QR code, and this will give you access to
Oh, great.
Doing stretches. Excellent.
stretches. Now, in addition to using this QR code to scan now, I'm more than happy to share it with Denise, and she can pass it around.
I don't have much knowledge on this space, but what's better for dealing with flexibility? Is it yoga or Pilates or the gym?
Very, very good question. Very, very good question. No right and wrong. In general, I would say the way gyms have developed over last 50, 100 years or so, there is a lot of focus on strength. It'll be hard to find when you go to a gym and work with a personal trainer that they will spend more than 5 minutes or 10 minutes on flexibility. They're likely to spend 50 minutes on strength training and maybe 2 or 3 minutes on flexibility, and if they are reasonably well trained. I'm not against gym. All I'm saying is that's the way it is developed, and it's no fault of theirs. That's how they're trained. If you are doing gym, just make sure you're spending at least 1/3 of the time in the gym in stretching. 1/3 of the time. That's a lot. And you can do,
So before and after.
before and after. And warm up and warm downs, we don't call them cool downs anymore, we call them warm downs. But to answer your question a little bit more honestly, I would say for people who work in the office or who are relatively sedentary, it is better that they involve in something that stretches out the whole body, including their calf, their feet, their wrists, their ankles, their neck. So yoga and Pilates is usually ideal. Yoga again, nowadays there are like 100 types of yogas. There's no right and wrong. Try 2 or 3 different ones and stick with whichever works for you. Similarly, Pilates. Most people don't understand Pilates are of 2 different types. One is like a studio Pilates, as we call it, which is closer to gym. So usually they're like 20 reformers, 30 reformers. There's a screen and everyone is doing the same thing. If you don't have any issues, any stiffness, any conditions, you're fine, you're fit, you're just doing Pilates for fitness, that is fantastic, because it's also relatively inexpensive to do. It's almost like a subscription or a membership model. You just sign up, you go there twice or thrice a week, and that works really well for most people. If there are any concerns or you want your program to be personalized, then clinical Pilates is the best bet. Although they both use the word Pilates, but they're very, very different. Clinical Pilates is where they're normally done by physios, where they do a full assessment, identify your medical history, look at your goals, and develop an individual program for you. And again, and they are reviewed frequently, and usually the classes are very, very small, like 4 to 5 people in a class, where you do your program and it is progressed periodically. So if you are into personalized fitness, then clinical Pilates, generalized fitness, studio Pilates, or yoga. And if you are disciplined with gym, with stretching, warm up, warm downs, then gym. A lot of people say, oh, I go for a walk. Fantastic, really great for feeling of well-being, good for your legs, good for your cardiovascular, good for your head. But does it really do anything for the spine? Not really. So if you go for a walk, great, but make sure you start with a simple stretching, warm up, warm down routine before and after your walks. This is our information. If you need any more information, you need any help, feel free to reach out. Now, open to any questions, any demonstrations.
So best time of day to be doing stretches, like first thing in the morning or at the end of the day, or like I say, just all through the day?
Again, no right and wrong answer, but in general, I would say if you prepare your body well earlier in the day, it helps you through the day. Depending on what you do, for example, you do an amazing stretching regime or routine for half an hour in the morning, but then for the 7 hours you're sitting. So will that half an hour help? Yes, of course. But wouldn't it be nice to actually stretch it out later in the day as well? It's logical, it makes sense. And wouldn't it be even better if by the end of the day you're not that stiff, not that tight? Even better. So that's where doing 2-3 minutes, once or twice a day. Again, it doesn't have to be like clockwork that you're doing every 2 hours. As physios, we like saying that, we love saying that, or do it every 2 hours, but I know that's not practical. Don't say this to my patients. We know that doesn't really work like that. But even if you're doing it, once morning session, once afternoon session, or get into habit. If you have read the book by James Clear called Atomic Habits, he quite often says, associate something that you want to do with something you already do. So it may be something as simple as every time you go and fill up your glass of water, you do 30-second stretch, the stretch that we did earlier. You try to touch the ceiling. That itself might be enough. So 1 or 2 times through the day, you might associate, just do a quick stretch before your lunch. Maybe not straight after your lunch, but just maybe before your lunch. If you are into long meetings, then maybe just one before your meeting, after your meeting. And then you can swap your stretches, play with what works for you. Coming back to that, Dave, Fardis, and myself, we have worked a little bit over the last 2-3 weeks as we were preparing for this presentation. So when you scan the QR code, you will see, I think there are 7 or 8 exercises. We have picked, they're very simple, they're very basic, but trust me, as physios, we have spent hours on selecting which ones, because we wanted to keep it very simple, but also easy to do, minimum time, and address maximum issues. So something as simple as that, 2 or 3 minutes might itself help you.
Awesome.
Anything else, guys?
You put the slide up that actually had the scan, the one before. I've got my phone now.
Oh, okay.
Isn't that the same scan?
No, that's a different one.
Oh, right.
So
There's 2 different ones.
the second scan was just to, if you wanted to consult.
Yeah.
This one is to access the exercise program.
Yep.
And by the way, as I mentioned, there are some flyers here which has this QR code, and we also happy to share this digital version of the QR code with Denise, and she can pass it around in your group, and you can basically scan it from there. Oh, yep.
Yes.
When you scan that, that takes you to Physi app, which is what we use to prescribe all these exercise videos.
Just to have that.
Thank you. Any other questions for Michael or Dave?
It's been great.
Just to have that, like, just
Alright.
double clicking.
Who's got a takeout that they're going to go back and think about when they're sitting at their desk or during the day? Do something, yeah. Hopefully a few reminders.
Oh, no, I've got to take
All
out in terms of stretch.
right, well, thank you very much. And,
Thanks a lot, guys.
and